Hey friends, so here I am with another topic, that is lateral and medial medullary syndrome. So, lateral medullary syndrome we'll be discussing in detail, whereas medial medullary syndrome will just mention the important points, because the most frequently asked question for the exam is usually a lateral medullary syndrome. Now, lateral medullary syndrome is also called as Wallenberg syndrome, and it occurs because of the thrombosis of posterior inferior cerebellar artery that supplies the dorsolateral aspect of the medulla. Dorsolateral aspect of medulla, and that's why it's also called as lateral medullary syndrome. Now, posterior inferior cerebellar artery supplies certain structures. So, when thrombosis of this vessel occurs, all these structures get affected. So these are the structures being affected. You can see the diagram, and vestibular nucleus, inferior cerebellar peduncle, spinal nucleus and tract of trigeminal, nucleus ambiguous, reticular formation, lateral spinothalamic tract. So these are the 6 structures that are being affected. Now, based on the structure being affected, the symptoms produced. If the spinothalamic tract gets affected, there is contralateral loss of pain and temperature sensation from the body below the head. If the spinal tract and nucleus gets affected, there is ipsilateral loss of pain and temperature sensation from the face. And if the nucleus ambiguous gets affected, ipsilateral paralysis of muscles of palate, larynx and pharynx. So this can result in dysphagia. Vestibular nucleus produces vertigo, affecting inferior cerebellar peduncle produces ipsilateral ataxia, and we said reticular formation gets affected. So when reticular formation, descending sympathetic fibers get affected, you have ipsilateral Horner syndrome. How do you investigate this? You do a CT or MRI. More commonly, you go for an MRI and other routine examinations to be done. The treatment is you have to admit the patient in ICUs and make sure that their airway, breathing, circulation is secure. And as I told earlier, because of the involvement of nucleus ambiguous, we said that there is ipsilateral paralysis of all these structures resulting in dysphagia. So since patients have dysphagia, they're at a very high risk for aspiration. So you have to pass a Ryle's tube, perform endotracheal intubation and feed them through Ryle's tube. And here, since thrombosis occurs and the blood flow reduces, it results in infarction. So it's basically an infarction, and for this infarction we have to treat it with antiplatelet drugs like aspirin, and statin drugs like atorvastatin can be used. That's the main treatment. Now, medial medullary syndrome is also called as Dejerine syndrome, and it occurs mainly because of the thrombosis of anterior spinal artery, which supplies the paramedian portion of the medulla. So, anterior spinal artery is just a short description. It basically supplies the anterior 2/3 of the spinal cord, and this anterior spinal artery usually arises from there are two arteries, and it's formed by the union of two arteries, which arises from the vertebral artery. Now, next turn is, depending on the structures being supplied by anterior spinal artery, we have certain symptoms. So here we have hypoglossal nucleus, medial lemniscus and corticospinal tract being affected, as you see in the diagram. The hypoglossal nucleus, medial lemniscus and corticospinal tract. Now, based on the structures affected, the signs and symptoms produced. If it's the hypoglossal nucleus, it's ipsilateral paralysis of tongue muscles. We know the hypoglossal nerve has a relation with the tongue. So, hypoglossal nucleus, ipsilateral paralysis of tongue muscles, element paralysis, medial lemniscus, contralateral loss of conscious proprioception sense, and if the pyramidal tract gets affected, contralateral hemiplegia, UMN paralysis. Now, so that's all for this video. Thank you. Like, share and subscribe, and hit the bell button for more videos.